So anxiety sucks and it's very common. 100% of people experience anxiety. But still, working as a doctor, I am surprised when I meet a young person and they are experiencing anxiety, but they might not even be aware that that is what anxiety is. So this video is all about anxiety in young people, and we're going to talk a bit about how it manifests, not only in the mind, but in the body, the physical symptoms of anxiety. We're going to talk about what to do when you're feeling anxious. Importantly, we're going to talk about what not to do when you're feeling anxious. And then we're also going to talk about what to do when it's getting so serious that it's preventing you from living the life you want to live. Anxiety is not a mental illness. It is a normal human emotion and experience. It is your brain's way of telling your body that there is a threat nearby. There's actually a part of the brain, it's called the amygdala, and it coordinates an entire brain and body response. We call it the fight or flight response, and that is what makes someone feel anxious. Sometimes it's normal to feel anxious, like if you're getting chased by a tiger, or if you're about to give a presentation. But when you're getting the alarm bells firing and serious anxious response when there is no threat nearby, when you're misidentifying threats and it's preventing you from doing what you want to do, that's when there could be a problem. The fight and flight response is a biological state of panic that your body can get into. I wonder if you've experienced it and not even been aware. It involves lots of uncomfortable feelings, things like your heart racing really quick. You might even feel it beating in your chest. You might get the sweats and find yourself sweating. Some people get tremors and shakes. Some people get nauseous. Some people get headaches, especially if it's associated with thoughts running in circles and circles. And on that point, you might even find that your brain is spiraling, your thoughts are spiraling. You know, what are they thinking about me? Do I look dumb? What are they talking about? You know, these kind of anxious thoughts. We call them ruminations, especially if they go in cycles and they never end. And that's all part of the fight and flight response. Now, before I go on, I kind of want to make an important point. Being a young person these days is very anxiety provoking. It's not easy. Your relationships with your family are changing as you develop your own independence. Your relationships with your friends might be changing as you learn who you are as an individual. You might start entering romantic relationships and all the anxiety that developed there. And you might start working and you know, that can be very anxiety provoking as well. And just to add fuel to the fire, the part of the brain that is involved in dampening down anxiety and telling your anxious parts of the brain to chill out, that part of the brain, it's called the prefrontal cortex, that doesn't finish developing till you're in your mid-20s. So you get all the anxiety and none of the regulation. It's not a good deal. So with all these things that you're going through, it's normal to get anxiety. And I don't want to pathologize normal human experience, okay? I don't want you to just automatically think you've got an anxiety disorder because you're experiencing a normal experience. But the good thing is that there's a lot you can do to reduce anxiety, even though your prefrontal cortex, that part of the brain that reduces it, isn't fully developed. So let's talk about what to do when you're experiencing anxiety. And in fact, I reckon that I can give you 3 really good tips on how to reduce anxiety in 3 minutes. It's not much time, but let's see how we go. So number 1 is your breathing. Do you ever realize that most of the time you're not even aware you're breathing? That's because your unconscious nervous system controls your breathing for most of the day. But your conscious nervous system can control your breathing. So if you're feeling anxiety, you might find your breath rate is going up and up and up, and it's hard to catch your breath. But if you do breath work, and I'll show you what to do exactly in a moment, you can lower your breath rate and your brain will realize, okay, there's nothing to panic about because the breathing is chilled and calm. It's called biofeedback. Your brain can learn from what your breath is doing. And so this is the technique to use. There's lots of different techniques out there. Do what works for you. This is the one that I suggest. It's called the 4-4-8 method. Okay? It's 4 seconds breathing in on an inhale, and then it's holding for 4 seconds. And then very importantly, it's a slow 8-second exhale. Let's do it together. I know I only have 3 minutes, but it's important, so let's practice it. Here we go. Breathing in for 4. Hold. 2, 3, 4, and breathing out for 8. Man, I feel so chill I don't even feel like continuing the video. But let's go to tip number 2. So tip number 2 is about movement. Okay, anxiety and fight and flight is about preparing your body for a threat. And so sitting still while your body is getting ready for panic or fighting or flighting, running away, that can make things worse. So there's lots of evidence out there to show that actually movement can be very helpful. And this is actually called sublimation. It's when you take energy from one type of energy, like anxiety, and you put it into another activity like exercise. Now, if you can go do a big weight strength running workout, great. But even going for a walk or doing a bit of yoga, a bit of stretching, walking your dog, these gentle exercises, or I guess movements, are really, really helpful for anxiety. I personally love walking my dog. I find it really, really like a nice way to kind of let my brain kind of get rid of what it needs to think about and then focus on my pet, and makes me feel connected. And tip number 3 is getting all the thoughts that are stuck in your head, going around in circles, getting them out, okay? Because the more you hold them in, the more overwhelmed you're going to feel. So getting them out is really important. There's different ways to do this. If you can talk to someone you trust, whether that's your parent or teacher or a supportive friend or a GP or a psychologist or a school counselor, great. If, by the way, you don't have someone you trust that you can talk to, please consider these phone lines I'm going to share. There's the Kids Helpline, Headspace, and if things are really dark, you can also talk to Lifeline. Now, Kids Helpline, by the way, has support for people with the age up to 25 years old. So it's not just little kids that can call it. So there are supports out there. Please consider contacting them. But if you just want to kind of, not talk to someone but get it out of your head, try journaling. It's really helpful because when you think, in circles, then it never really ends. But when you write, you're taking these circular thoughts and you're putting them in a line. It's called linear thinking. So you prevent yourself from going into cycles that can really be anxiety provoking. Not to mention, it's very cheap. All you need is a paper and a pen, and it's very private, and that can be helpful too. So I've lost track of time. I don't know if I've hit the 3 minutes or not, but now let's talk about the top 3 things of what not to do when you're feeling anxious. So number 1 is please avoid social media. I know it's where you might go to kind of switch off, but comparing yourself to others never helps anxiety. And you're not really comparing yourself to others, you're comparing yourself unconsciously to the best possible representation, a fake persona of someone else that is presented to the world on social media. This perfect looking person who has everything, together, and their life just is looking amazing. That's not reality, okay? And it doesn't make you feel better when you're seeing other people's incredible lives that aren't even real. It's much better to do non-social media activities if you're feeling anxious. Tip number 2 of what not to do. Look, I'm not going to sit here and say, don't do drugs, kids, because that goes in one ear, out the other. But this is the key thing to remember. Don't use drugs to treat anxiety. Okay, that's called self-medicating, and it's very common, and it's a very common cause of addiction because basically the teen brain is learning that the only way to feel less anxious is to do drugs. The only thing that helps with my anxiety is now drugs, and now I'm going to be smoking weed every day to get to school. I'm exaggerating, but it can become a very slippery slope to losing control of substances and developing an addiction, and that's a very difficult thing to break in the future. So if you find that you're using weed, alcohol, whatever, to kind of reduce your social anxiety, that's a big hint that you probably need to talk to a professional like a doctor about other strategies that are healthier so that you don't develop an addiction, because that's a really difficult thing to break in the future. The third thing not to do is to not get help. Don't be scared of getting help is the point I want to make. I got into, medicine and psychiatry because I want to help people. Psychologists want to talk. Doctors want to help. We're not going to bite. We're nice people, I hope. So try us out. It can be kind of anxiety provoking to to do it for the first time, to talk to a doctor, but all you have to do is get to the door, and the doctor or the psychologist, we can help support you to figure out what to say or what not to say. Don't feel you have to talk about anything, but just get to the door and we can support you the rest of the way. So on that point, now is a good time to talk about when should you go see a doctor? It's a great question. It's hard to answer, but I would say that if you're finding that anxiety is preventing you from living the life you want to live, so it might be preventing you from seeing friends or going to school or going on a date, that might be the time where you might need further support if it's getting so severe that it's stopping you from doing what you want to do. So when you go see a doctor, they can help make a diagnosis if there is an anxiety disorder. And there are many anxiety disorders out there. So for example, there are social anxiety disorder, where someone has a deep fear of what other people think about them and they might have a low self-esteem. There's generalized anxiety disorder, when there's all these different things from home, from school, from friends, from money, from all these different things that are causing anxiety, and it's affecting sleep and mood, and it's really unpleasant and it's pervasive. It's going on for a long time. There's a thing called panic disorder, where people are getting panic attacks, and they're getting so many disabling panic attacks that they even get fearful of having further panic attacks, and so it stops them from doing the things they want to do. And there are things like phobias, where you have specific, intense fear and panic from particular things like snakes or spiders. Now, anxiety is common in lots of other mental illnesses or mental disorders as well, like PTSD. And it also can be hard to distinguish from other mental disorders or mental illnesses like ADHD. Sometimes it's hard to disentangle what is one or the other or what is both. And that's why you need a doctor and not just a YouTube video to make an assessment. That being said, about 1 in 4 young people, teenagers, do experience an anxiety disorder. So it's very, very common, and there are very effective treatments out there. Just a quick note on treatments. In young people, we tend to favor psychological strategies and psychotherapy, which is when you work with a psychologist to develop different strategies to manage your anxiety. But if needed, there are effective medications that can help reduce anxiety as well. Okay, so I'm going to leave the video there. I just want to say this though. Anxiety does not make you weak, it makes you human. And if it's getting to the point where your quality of life is getting affected, please seek help. There's very effective treatments and support out there. I wish you all the best. If you found this video helpful, please give it a like, and that helps YouTube share it to more people. And if you want to see more videos from my channel, you can subscribe as well, and that supports me too. Other than that, I'd be interested in reading your comments down below on your reflections of what anxiety is like for you and any tips or tricks you've got to manage your anxiety. And I'll leave the video there. I wish you all a beautiful day, and I'll see you in the next one. Bye for now.